Disability and healthcare access. So, people with disabilities have a number of options for healthcare coverage, and one of those include Medicaid. And if they have Medicaid, they are considered covered under the healthcare law. And this means that they do not need to get a marketplace plan and they do not have to pay the penalty that people without coverage have to pay. And then, if an individual does not have Medicaid, they can apply for it, but whether or not they even need to apply depends on the state that they live in. Some barriers to healthcare access for the working age adults include 1 in 3 adults with disabilities ages 18 to 44 do not have a usual healthcare provider, meaning they don't have that primary doctor that they go see frequently. 1 in 3 adults with disabilities ages 18 to 44 have an unmet healthcare need because of cost, and that is within the past year. And 1 in 4 adults with disabilities ages 45 to 64 did not have a routine checkup in the past year. Moving on to cultural indicators. In the American Indian and Alaska Native cultures, 3 in 10 people have a disability. 1 in 4 people have a disability in the African American culture. 1 in 5 Caucasians have a disability. In the Native Hawaiian and Pacific Islander cultures, 1 in 6 people have a disability. In the Hispanic culture, 1 in 6 have a disability, and 1 in 10 have a disability in the Asian culture. And then continuing on with cultural indicators, a little bit more statistic. In the American Indian and Alaska Native culture, 40.6% of the disabled are obese and 41.2% of them smoke. In the African American culture, 47.3% are obese and 28.1% smoke. And then 35.5% of disabled Caucasians are obese and 28.7% of them smoke. And then in the Native Hawaiian and Pacific Islander cultures, 31.8% are obese and 28.2% smoke. 39.9% are obese and 20.6% smoke in the Hispanic culture. And in the Asian culture, 20.3% of the disabled group are obese and 12.8% smoke. So if you want to go ahead and click the next link, we can move on to psychological indicators.